Hello and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm your host and their daughter, Heather McDougall. And this is a chance where we can get to your questions from, anything that you want to talk about. So hello, Mom and Dad. Great to see you. Thanks for being here.
Hello.
Yeah.
Hello, everyone.
How are you?
Happy New Year. Or we did that last week.
We did that last week.
Oh, well.
Last
We
week.
did. So I have dozens of questions. People are emailing me questions every day, and I know I'll have questions coming in tonight, but I know you wanted to start out talking about some things that are going on in the news. So
I'd like to do it without the disclaimer.
Absolutely.
All right. Now I'm all set. Yeah, I want to talk to you about a couple of things, correct some things from last time. And I want to talk to you about, there's a new Alzheimer's drug. It's pronounced Flaxseed. And, it involves making antibodies to certain parts of the disease, Alzheimer's disease. And it's supposed to somehow take care of the proteins involved with Alzheimer's. Alzheimer's is a dementia. 60% of dementias are due to Alzheimer's. And, you're told it's due, well, we don't know, genetics or, the wrath of God or whatever. I think as close as they come to diet is a discussion about, excuse me, how Alzheimer's is related to the rich Western diet. That's about as far as they've gone in terms of dietary link to Alzheimer's. But if you look at the research, and you can find this, I started publishing this back in 2004. And I brought the research up to date many times. In fact, I did a recent article in 2017 on it. You'll see that it's due to aluminum poisoning. Aluminum pots and pans, aluminum cans, baking sodas of some types are full of aluminum, cake mixes, all kinds of things. And
Antiperspirants.
that's one of the most common portals. Not the gut is one way that aluminum gets into the body, is through swallowing it. But breathing it is the most serious way, the most serious portal of entry of the aluminum into the body is through the nose. And of course, antiperspirants do that. Anyway, that's the cause of it. That we're going to be putting out a little bit of a notice here in the next few days, and you can look up the references, or you can look it up yourself. I mean, put in aluminum and Alzheimer's disease, go to the National Library of Medicine, or just Google aluminum Alzheimer's. You'll see overwhelming the evidence that it's due to aluminum poisoning. Anyway, there's no drug that's effective, or at least up until date. And still, I believe there's no drug that's effective, except for what I'm going to talk to you about in just a minute or two. But the claim is, it was been in the newspapers this week, is a drug called Flaxseed, which costs Flaxseed, thank you, Larry. Flaxseed, which costs $26,500 a year to take. And you got to be on it, or once you stop it, you don't.
You're going to be on forever, you mean?
Yeah.
Oh.
And what they claim is a 26% reduction in deterioration. And it's such a small reduction that there's arguments in the medical community about this drug. And another one that came out last year that showed that cost $56,000, and that the scientists couldn't agree upon whether that works at all.
Well, it must be better because it costs more.
Well, actually, I'd have to say the reports are worse, Mary.
Oh, really?
Yeah, but this has been in the news this week. 26%. In other words, at best, they did 25% better. Okay.
How do they measure it?
Well, what they do, this is an interesting thing, is they do clinical examinations. They watch people as far as their daily activities go, and their skills and various types of tests as far as loss of abilities. But it's mainly watching their living activities.
Okay.
And so back in the 1980s, there was a treatment, and it's published in our major medical journals, using a drug called, it's deferoxamine or desferoxamine, depending on how you look it up. Deferoxamine, Deferoxamine. Deferoxamine is a generic medication, costs almost nothing. And the studies show, and this is a control trial where they used a group that didn't get the drug versus the group that got the drug. And it was administered by giving shots twice a day intramuscularly. And they showed that those who took deferoxamine, they did twice as well at the end of 2 years as those who didn't get the medication. In other words, far better than these new fancy drugs.
And that probably costs hardly anything.
Well, it's generic.
Oh, so it's cheap.
And it never became popular. And the excuse was, well, you can't ask somebody to get shots in their muscles twice a day. Well, excuse me, have you ever lived with a family or known a patient who has Alzheimer's disease and the suffering they go through? Anyways, it never got popularity, never got the fights that have been going on for the last 2 years between the FDA and the medical community and the scientists and the drug companies to bring these drugs to market. Okay, Lecain B. Thank you, Mary. Lecain B, and the other medication, I don't have the name right at hand, but it's something that's almost unpronounceable. And they've been arguing to get this approved, and it's finally getting approval. But deferoxamine, which has been shown by a controlled trial back in the 1980s, published in our major medical journals, showing that people who received the medication were doing twice as well with living activities. That's how they, how you take care of yourself, your clothes, you interact with your family and this type of thing.
But doesn't it also have a lot to do with memory? So if you couldn't remember to do how you did those things, that's how they would measure it?
Well, that'd be one of the parameters. Yeah.
Okay.
And they took movies, actually, these people. That's the way they did it. And they had a independent group look at the different patients and saw which ones were being more active and were more capable of performing activities and so on. Anyway, the point being is the public is being cheated because of money again, because of the drug companies. And good treatments, not great treatments. It's not none of these. Well, okay, they claim that Lecain B is not a cure. All right. They say that right in the article. It's not a cure, but deferoxamine is a cure. And the reason is it removes, it's an aluminum chelator, and it removes the aluminum from the body and the brain. Aluminum is the cause of Alzheimer's. You're going to look it up. You're going to read the science. I know you are, because I've challenged you to do it. And when Heather puts out the article, and this coming week or next week, I gave you a couple of the scientific references. I've been studying this since the early 1980s. And, I've always been dismayed at the fact that a good treatment, an available treatment, one that deals with the cause and cure of the disease has never been used because it's generic. It costs dollars as opposed to, $26,000 or $56,000 a year to use these fancy drugs.
You still need a prescription for it though, right? Or can you buy it over the counter?
If you go to Google and you look up Google Images, because I've done this, you can actually find it for sale, deferoxamine.
Really?
And in little jars. In fact, a part of the images that we put out in this article will be vials of deferoxamine.
So you can buy it.
You can buy it. Now,
wow.
Whether you need to have a doctor's prescription or not, that's just a small thing. All you got to do is convince your doctor. All you have to do is show your doctor the science and show that it does you no harm. It's, except for a poke, in the muscles, it does no harm. Whereas this other drug causes brain swelling and bleeding. The $26,000, the $56,000 drugs are very toxic.
That's amazing.
Well, it's just business as usual.
Yeah.
Anyway, that's what I wanted to start out by telling you. And you'll pursue it. Those of you who are interested will take the trouble of looking for, if you sign up for the newsletter, it'll be a short discussion will be in the newsletter. And if you go to our website and you look up aluminum and Alzheimer's disease, you'll find 2 articles that I've written. One back about 20 years ago and one that I wrote in 2017. And the evidence is there. You can read the scientific research. You can see that what I'm telling you is not an exaggeration. Oh, and by the way, I thought you'd add this. What other way did I tell you could get rid of aluminum from the body? Do you remember?
Silica.
That's right, silica. You're paying attention.
Yeah.
Silica, yeah. Silica is a natural substance that's found amongst rocks. Plants pick it up. You get it in various teas. They also sell silica water. And again, you can look this up. You can buy it on Amazon. Silica water. There are several brands of it, and silica that is present in the silica water actually significantly, and has been proved to take aluminum out of the body.
Didn't we hear a joke last night on one of the late shows about one of the hosts said that they were going to, one of their New Year's resolutions was they were going to eat the little packages of
Oh, yeah. That silica, it's the stuff. Thank you, Mary. I know why I asked you to sit to my left. The left seat's where the pilot sits, right?
Yeah.
All right. Silica, it's the stuff they put in your packages to cause them to be dry.
Yeah.
The same stuff. Don't eat the package. It says don't eat the package. It's on the side. All right. Anyway, that's hopefully that's everything you wanted to know about. At least everything you need to know for now to get you stimulated to learn. 60% of the cases of dementia, we're talking about millions of people. We're talking about a disease that was discovered in the early 1900s by Louis Alzheimer. He found the first case. That's all there was one case. And in the 1930s, they could find 33 cases. And then when aluminum started being used in manufacturing, it's gotten into the millions. I mean, we're talking about tens of millions of people suffer this dementia from aluminum poisoning. The aluminum industry is very, very rich. They got lots of money. And I want you to know about it. Anyway, challenge me. Show me I exaggerated. Tell me this isn't something that you should have known about 40 years ago. And many of you will know people with Alzheimer's, and challenge them with the science. Look up the literature, challenge your doctor, say, hey, that's not exactly all I want to talk to you about. The other thing is that last time you asked me a couple of things that I think I told you I didn't have the answer for. That's usually when I don't have the answer. I don't have the answer. I mean, there are lots of things I don't know.
You go and look it up.
Go and look it
up. You can pass me the Alzheimer's paper.
Okay.
Then we can look at the next one.
All right. So I did a literature search on it was about the medications that are used to prevent bone loss and osteoporosis related fractures. And there are just dozens of them that are used. What I use, let me tell you what I use to keep your bones strong, is I use a diet that's low in protein and low in acid, because it's acid that depletes the bones of bone material. The bones dissolve because you eat a diet full of acid, and that's the high protein, meat-laden, dairy-laden, cheese-laden, fish-laden, poultry-laden American diet. These are high protein, high amino acid foods. And anyway, the bones dissolve to neutralize the acid that you eat. Then you make a little bit of acid in your normal metabolism too. So anyway, the way I treat Alzheimer's is I put you on an alkaline diet. Our diet is an alkaline diet. And I have you get a little careful, safe exercise. You don't want to go out and get run over by a car or anything. That'll break your bones. And you get some sunshine. And then the next step that I take is I put people on antacid medications to neutralize the dietary acids. That's what I do. And the most common antacid medication I use is Tums. It's not because of the calcium, it's because of the carbonate, the alkaline part of the Tums. And the other thing that I use hormone replacement therapy. And somebody who has really, really a high risk of fracture, not somebody who just flunks the bone mineral density test. I'm talking about somebody who's had fractures that really shouldn't have happened. A low amount of trauma. I'll put them on an antacid medication. Change their diet, of course, a little bit of exercise, sunshine, and I'll put them on, as far as medication, I'll put them on hormone replacement therapy, because estrogen always builds bone. Okay, I mean you can count on it. I know one of the people who have been listening to this presentation we give every Sunday at 5:00. They went to the doctor to ask about estrogens, whether it really builds bone or not. And the answer was, oh, that's silly. Well, my answer to her was she needs to get another doctor or do the research yourself. Do you know how to do it? Go to Google, go to the National Library of Medicine. Anyway, so I put them on a little hormone replacement therapy. Anyway, there are a whole bunch of drugs that are used. They're the bisphosphonates, like Fosamax. It's got side effects like you get necrosis of the jaw bones. You have a high rate of fractures in the lower extremities. Maybe heart disease. It's got a lot of serious side effects. Well, it doesn't cost very much because it's generic, and but it doesn't work well. I mean, the benefits are extremely small and difficult to show in any way. And the drug companies do whatever they can to manipulate the presentation of the data to try and prove to you that it's a benefit.
You don't hear about that. You don't hear about many advertisements about
Fosamax?
About any of the supposed bone building drugs anymore. So maybe they realize that none of them work.
Well, Prolia, let's see, that was the one that I was asked about.
Okay, let me know. I have the papers.
All right. There's a lot of material here to remember. Okay. All right. Well, we have, it was Prolia. That's what you asked me about. So. Yeah, Prolia. Anyway, it's supposed to be used as an alternative to Fosamax, bisphosphonates, if they don't work. And you're supposed to use the Fosamax first and then use the Prolia.
Here's another one that we hear a lot about.
Boniva, that's a bisphosphonate.
Yeah. Okay.
So that's one of, then I just told you the side effects of bisphosphonate. That's necrosis of the jawbone and fractures. Anyway, the Prolia, I kind of mixed up, but I told you I mixed it up. I told you that I didn't really remember. I can't remember all these different medications. And maybe if I was still in medical school, I could, but I'm not. Anyway, Prolia it's to be used in only patients at high risk of fractures, and it has just a small benefit and significant side effects with this medication. Let's see if I listed them here. Anyway, I'm sure I did. Here it is. Okay. It's injected. Oh, the expense is like $1,300 for one vial. And you're supposed to take a shot a month. There's some recommendations that are a shot every 6 months, but also other recommendations, $1,300 a month to get a shot of this stuff.
That's not the one where you have to sit up after you take it.
That's the Fosamax.
Oh, okay.
Because it causes esophageal problems.
Yeah, I
Thank you,
remember.
Mary.
I remember hearing about that.
Yeah. Anyway, all right. So my point being is that there's a lot of medications out there that are high profit and high tech. And the reason you're advertised these medications, diabetic medications, cholesterol medications, et cetera, is because the drug companies make a ton of money. That's the only reason. If they were telling you the truth, they'd advertise medications that cost virtually nothing, like Tums or skin creams for estrogens. But it doesn't work that way. Ladies and gentlemen, it doesn't work that way. This is a business. Grow up and be cautious. And let me see if there's anything else here I want to talk about.
Okay.
Anyway, I want you to know that you ask me lots of questions. I'll tell you if I don't know, and I'll take.
And then he'll have the answer for you next week.
Try to. Okay, the cost of one syringe is $1,278.80.
And that'll last for a month?
Once a month.
Okay.
Well, this recommendation says every 6 months, but other recommendations are once a month. Anyway.
Well, here's another one that you pulled out. About flaxseed.
Oh, yeah. Thank you, Mary. The other thing you asked me about was, does flaxseed lower blood pressure? And I said, I don't remember that it does. And I know it lowers cholesterol, and does it lower blood pressure? And I'll tell you, the reviews I did show that it lowers blood pressure, but just a little bit, not much at all, like a decrease of 1.77 millimeters of mercury.
Well, that's hardly anything.
Hardly anything, I would say so. That's for the systolic. The diastolic, 1.58 millimeters of mercury.
Not much more.
Anyway, so yeah, you were right by asking the question. I didn't have the answer at hand. And as many of these studies, they use flaxseed oil. But in one of the research papers, I found they actually used the flaxseed. Look, just eat good, go for a walk, get a little sunshine, And almost all of you will have normal blood pressure. If you don't, maybe one, maybe two out of 100 people I take care of can't get their blood pressure normal with some simple dietary changes and associated weight loss, and be off the medications too. Then you take the only medication that's proven to work, which is chlorothalidone, which is like pennies. It's cost you 90 pills at Walmart for $10. Anyway, I think I've said enough, Heather.
Okay.
Okay, good. I've got lots of questions coming in, but let's start with a couple that were emailed to me. This first one comes from Gary, and he's wondering what your view is on drinking green tea, specifically matcha.
I think it'd be okay.
Yeah.
What do you think?
Yeah.
I don't think see, if you're drinking green tea to compensate for a tri-tip steak and cheesecake, that won't go work. If you drink green tea because you enjoy it, it has a little caffeine in it.
That was quite a bit of caffeine, especially the matcha.
Yeah. So, if you get a little high, and it's nice to get high, so I don't see any serious adverse effects. I don't see any reason that you should avoid it. But I don't want you to take it as a therapeutic measure to get yourself well. Do we have any matcha around?
Yeah, I think so, in the cupboard.
You don't drink it very often.
No, it's in the back of the cupboard.
We drink regular tea. We drink decaf tea.
Yeah.
I wondered why I wasn't having as much fun.
People always drink decaf tea.
Anyway.
But a
Caffeine's
little
fun.
bit of caffeine's okay.
Well, Heather, I've come from different positions on caffeine. I suppose it depends upon whether I was drinking coffee or not, my point of view. The serious side effects that you ought to know is it causes terrible indigestion. Not caffeine, coffee does. It's the other alkaloids in coffee, not the caffeine, but the other alkaloids that cause acid indigestion. And you need to know that decaf coffee causes as much indigestion, distress, stomach distress, as regular coffee because it's not the caffeine.
Yeah, tea doesn't cause abdominal distress.
No, that has caffeine in it too. Caffeines will raise your blood pressure. It'll make you anxious. I mean, good grief. Times when I've drank coffee, I couldn't hold a pointer still. It causes, and 1 cup of coffee a day will cause some people to not be able to sleep at night. Every serious coffee drinker knows where every bathroom in town is, because they're always urinating and defecating, often at the stimulus from the coffee. There's been some research, mostly came out of the 80s, that suggested that caffeinated beverages, which is usually how you get it, would cause fibrocystic breast disease. I don't believe that's the case, but they used to talk about that. What else? But anyway, the new stuff that's come out has been very, very favorable to coffee. Not only does caffeine, well, coffee, let's face it. That's what
they usually talk about. Yeah.
Very favorable in terms of making you more alert, keen, waking you up after your mid-afternoon slump. But the other thing is there have been a lot of papers that have suggested that caffeine will cause you to live longer. Not just have more fun, but to live longer. And again, you have to understand the bias. People who have these things in their life and enjoy them, people love to hear good news about their bad habits. That's what you have to understand. So I'll give you both points of view, and I don't think you'll know when you have some adverse effects to these medications. You'll be carrying around a pocket full of antacids because you have constant indigestion. You'll know that you're running for the bathroom all the time. You'll know these things. You'll feel the anxiety. And the ultimate outcome is you may reduce your risk of dying of heart disease, which has been shown. May reduce your risk of certain cancers, been shown. And so that's the best point of view I can give you. And I don't have to look that one up because I know that one pretty good.
Okay, so I'm going to drink my cup of coffee in the morning guilt-free, right?
You enjoy yourself, Heather. And again, you drink 1 cup of coffee a day. The problem is some of us have personalities that cause us to do everything in excess. And I have to admit,
You're one of them.
I mean, I don't do a little bit of anything. So I've had to, in my life, I've had to identify the things that were killing me. Alcohol, coffee, rich American diet full of bacon wrapped hot dogs. Cigarettes, yeah. I didn't mention
You
cigarettes.
didn't mention cigarettes. So you can do.
Well, I'll tell you, I have 20-pack years behind me. But I was dying. I mean, even I quit when I was, what, 24,
Well, we quit
25?
50 years ago. So.
October 20th, 1972, at 7 a.m. in the morning was my last cigarette.
But who's counting?
Any smoker out there knows, if you're a smoker, you know the day you quit. Just like every drug addict, every alcoholic, you know the moment you quit, because it was a big deal. Anyway, there are bad habits that hurt people terribly, and you need to identify them. And if you're like me, and you decide that they're really destroying your life, you need to do it 100%. I can't do a little bit of anything that is harmful. I don't know, maybe you're the same way. You know, Heather can have 1 cup of coffee a day. I'm not that kind of person. So, I drink decaffeinated tea.
Okay, next question. This is from Natalie. I'm concerned about taking tamoxifen. I'm premenopausal. Is it risky to not take it and just focus on a strict whole food plant-based diet?
Well, I'm assuming that you have breast cancer. That's why you take tamoxifen. The other reason is you may have ductal carcinoma in situ, or some doctor may have thought that taking tamoxifen will reduce your risk of eventually getting breast cancer. But almost everybody I run into already has had a diagnosis of breast cancer. And tamoxifen is an anti-estrogen drug. Yes, anti-estrogen. And so estrogen promotes breast cancer, period. It does. It promotes a whole bunch of other negative things in women too, and some positive things, very positive things. Like without estrogen, you pretty have a tough time being a woman.
Well, and you just said it's good for the bones.
It's good for the bones. Yeah. And, there was an article, which was kind of interesting. It was in the New England Journal of Medicine about how overweight women have fewer fractures. They have better bone mineral strength. But overweight women also have a higher rate of breast cancer and uterine cancer. And they didn't make the connection. When you're overweight, you carry a lot of extra weight around, so you get more exercise. But the fat cells make estrogen, which strengthens the bones. But that same estrogen promotes breast cancer. And that's the connection between being overweight and having fewer fractures and having more breast and uterine cancer.
So they prescribe tamoxifen so you don't make as much estrogen.
Well, it works at the cellular level. You still make the estrogen. It just doesn't, it's blocked at the cells.
So it's good for breast cancer.
I think so. I think it is. I recommend women do something about their estrogens because estrogen promotes breast cancer. And so I take care of a lot of women who have breast cancer. And so I tell them, first of all, you need to change your diet because that's the most profound way to drop your estrogen safely. You cut your estrogen levels by 50% when you go from the Western diet. They're 50% too high. That's what they are on the Western diet. You cut it by 50% down to what they should be normally, normal estrogens, just by changing your diet. And then if a woman has breast cancer, I give her 3 options. One is tamoxifen, which again works at the cellular level, at the body cells, in the cancer cells, and blocks the activity. And then there's another class of drugs that's similar. They're called aromatase inhibitors. Arimidex is one of them, aromatase inhibitors. And that's another option. And whether you take one or the other depends upon the flavor of the week, whatever your doctor has to believe in. But there's a third option that I recommend to women, or at least to think about. And as opposed to, say, 5 years of taking tamoxifen, which you generally recommended is 5 years, and these days, 10 years of taking tamoxifen if you have breast cancer. Instead of having to take this pill, which, by the way, increases your risk of uterine cancer and increases your risk of getting osteoporosis and puts you into menopause. So you have menopausal symptoms. So you got to pay for the drug, you got to remember to take the drug, you have significant adverse effects, is what I recommend is that they have their ovaries removed. And think about it for a minute. We're talking about spending a few minutes in an operating room.
Well, they do it by laparoscope, so it's just a little tiny incision.
A little tiny incision.
You don't even need to general anesthesia anymore, do you?
Yeah, they still do it.
Do they? Okay.
Yeah, they still do that. But you know, a little tiny incision about this big, a couple of them, and they go in and they take the ovaries out, and then you decrease your estrogen level a lot, and it does make a difference in survival. All three of these approaches do. Then don't think I left out the diet part.
No, you didn't.
Yeah, I know. I told him I don't remind me.
Okay.
Okay. So anyway, I have many women who say that they don't want to take any of these medications, and they don't want to have their ovaries removed. Big deal. I mean, we're not talking about that much of a benefit. Susan B. Korman, yeah, right. The Susan B. Korman site has a really good evaluation as to what the benefits are of taking tamoxifen, and you know, it's worth looking up. It's a reference that I give to our patients who have breast cancer and who think about taking tamoxifen as to what the real benefits are. They're small, but they're real. So anyway, that's probably a good enough discussion about estrogen.
Great, thank you. Next question from Carol. She's wondering if there's any natural remedies for recurring UTIs.
Yes, there are. Recurrent UTIs, urinary tract infections we're talking about.
Yes.
Yeah, that's right. Isn't that right, Heather? Urinary tract infections, UTIs?
Yes.
Okay. First of all, you want to think about honeymoon cystitis. You know, women learn that when they have vigorous sexual activity, they're likely to have bladder infections right afterwards. So what do you do about it? Well, you know, there's something called being careful. You know, thinking about what you're doing in terms of this very tender area in a woman's body. You end up too vigorously stimulating the urethra, you know, the tube where the urine passes out, and it swells. And so you just need to be careful. You know, you don't necessarily have to avoid sex, but, you know, that may be an option you want to do too. So that's a natural thing to do. Doesn't sound very natural to me, but even at my age.
Well, I've heard that. I've read about it, and they say that after sexual activity, it's wise for a woman to urinate afterward.
That's something that it works. Yeah.
Okay.
That's one thing that works. But the other thing is that you can take natural medications or antibiotics.
Cranberry pills.
That's what I was going to say. Yeah, you can take cranberry and blackberry. This has been proven. I mean, the research is there. I don't care how many poo-poo opinions you have about it doesn't work. It works. There's a substance in cranberries and blackberries and probably lots of other berries that prevent the attachment of the bacteria to the bladder wall. So not only do you prevent bladder infections, but you also can cure them. Now, of course, there's a lot of competition out there because there's a big push for you to take antibiotics instead. Don't take, but you got to take a lot of cranberry juice. You got to sit down and you got to drink a whole bottle of it.
Don't they have cranberry pills now that are concentrated?
Yeah, you can do that. Yeah. And so you could do that, and there's a couple of natural ways to do it. And then the other thing is antibiotics. Let's talk about that for a minute. Usually the prescription for antibiotics, or it has been in the past, is to take antibiotics for 10 days if you get a urinary tract infection. And Septra or Bactrim are commonly used. Ampicillin, amoxicillin are commonly used medications. And it works. But the thing you need to think about is there's another way to take the antibiotics, which is proven to work. And that is you take a double dose once. Okay, so whatever the dose is recommended, say 1,000 milligrams of amoxicillin is being recommended, you take 2,000 one day, and then you don't take any more. And you get the same cure rate. Or the Septra, you take a double dose of Septra, and you don't need to take any more. You get the same cure rate as if you took it for 10 days.
But then you have a problem with having a vaginal yeast infection. And
the more antibiotic you take, the more likely you are to have the problem, and the higher doses too. And by the way, in the book, McDougall's Medicine, A Challenging Second Opinion, which I wrote in 1984, the first couple of pages in my chapter on urinary disease, it talks about taking double dose of antibiotics as opposed to 10-day course. So I don't think Heather's giving that book away this month, but she will. She does once in a while. But you can get it. It's cheap on our website. McDougall's Medicine, a Challenging Second Opinion. But Heather got carried away last month and gave away all our books for free.
Well, it was the holidays, yeah.
Anyway, it's worth it at any price. Great book.
Okay, great. Thank you. Next question. This is from Lou. Do you have any advice on how to pick the right doctor?
I do. I do. There's a whole section on our website, drmcdougall.com. You go under hot topics, and it's called Working with MDs. And this section talks about whether or not you should get a physical examination every year. The answer is no. Every organization, the American Medical Association, the American College of Physicians, which I belong to as an internist, the American College of Family Practice, every organization says don't do an annual physical examination. So, once you see a doctor is when it's called upon. And your body usually lets you know when you ought to see a doctor. And before you go in to see your doctor, in most cases, you ought to sit in your car in the parking lot, and you ought to practice a word that too seldom comes out during a doctor's visit, a 7-minute doctor's visit. And that word is no. You just sit there for 10, 15 minutes. You go, no, 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 no. So it just kind of rolls off your lips. No, I'm not going to do that. Because otherwise, most patients, they go in the doctor's room and they think they're sitting next to God or some authority that's going to punish them if they don't listen to their advice. And they do whatever the doctor says. You got to get over that. Anyway, so be prepared to come in with a list. I think that's really important of things. When there's a list, you have to talk about what's on the list. So the 7-minute office visit stretches into 20 minutes. All these things have to be answered, doctor. It's a list. I got a list. If the doctor doesn't have time to answer all the things, he says, look, I'm falling behind my patient. You say, here's my list. Call me after work. Answer my questions. Here's my list. How do you find a good doctor? Well, I think you got to interview doctors. It's really important. And you look for somebody who has a talent that you want to purchase. All right. You don't look for a doctor who eats a good diet, or you don't even care if they smoke cigars. You don't care whether they wear their safety belt or not. You want somebody who's good at whatever you need. Like, for example, if you're having plastic surgery, you need an artist, somebody who's really innately talented at the artwork you need to have done on your body. If you're having a baby, you want to have somebody who really knows how to deliver that baby and is excellent about it. You don't really care what they ate for lunch. They're going to make it through the delivery. So, pick the specialist that you need the services from.
Yeah, but then you're picking someone who, you might go in there. I was thinking when you said that about picking someone who really is good at delivering babies.
Yeah.
But then you also have to face the fact that someone like that is going to say, well, you need to take prenatal vitamins, so you have to get really good at saying no.
Yeah.
You
have to read my January.
It'd really be nice if there was a list of doctors that were
natural
and that were good at what they did.
How about just doctors who want to have a natural birth instead of C-sections?
Yeah, that'd be nice.
But like somewhere around 30% of women end up having C-sections, whereas the cesarean section rate should be about 7%. In some countries like Brazil, it's like 80% of women have C-sections.
They schedule the time they want to have their baby.
It also pays more. It pays more to take it out to the top than the bottom. But you have to do a little homework and find out. Well, how do you find out? Well, how do you find out? Okay, you've narrowed it down to the right doctor with the right talent. You're going to take the trouble to interview the doctor, but how do you narrow the field a little bit? you got to ask questions. You can ask your friends and neighbors, and they could be helpful. But then again, it might be the personality that they like or whatever. The best people to ask are nurses. Mary's been an office nurse and a hospital nurse. Office nurses are loyal to their doctors. Don't ask them because,
That's
anyway.
true. That's true.
But when you work in a hospital, you watch the doctors and you don't have any particular loyalty to them. And you're going to find, the rumors that go around, you know who's good at taking out gallbladders and who botches the operations. The gossip in hospitals, it's a grapevine. Everybody knows everything. You don't even have to ask a nurse. You can ask the janitor, and they know who the good doctors are in a hospital. So that's one way that I would narrow is I'd ask people who are close to, but not too close to doctors. And then after you've done your homework, there are certain things you might be interested in, like whether or not they're board certified. I'm a board certified internist. What does that tell you? It tells you I know as much as the other people. I took a test that proves that I know as much standard medicine as anybody other internist. But, in addition to that, I have other interests. So, there's some tips on how to pick another doctor. But that whole section, hot topics, my website, drmcdougall.com, hot topics is called Working with MDs. And it talks to you about how to pick a specialist, talks to you about how to pick a general doctor, and how to get more time with the doctor. You might think about paying for it. I mean, it's your life. You're deciding whether you're going to have your breast cut off or not. And please get a second opinion. Now, the way you don't get a second opinion is you don't sit in a doctor's office and say, who would you recommend for a second opinion? Now, what do you think is going to happen if you ask a doctor or their staff for a referral? Well, I'll tell you, they're going to refer ever again to a doctor that contradicts what the original doctor said. Plan on it. So you have to ask for a second opinion. Who would you ask? Well, you could ask a nurse, like I told you, or look it up, do a little research on the internet to find out a second. Go see these people. You're talking about some things that have changed the rest of your life. Spend a little time figuring this out. And you might spend a little money too. I mean, these are professionals. They need to be paid. So tell the doctor, look, I'll pay you $300 if you'll read these research papers on Alzheimer's and aluminum and deferoxamine. I'll pay you an extra $300 because I want to know whether this is worthwhile or not. I know your time's valuable. I know I'm interfering with your golf game, the time with your family. So I'm willing to pay you. And that's fair. But going with the attitude that your doctor is a human being, going with the attitude that your doctor is like a used car salesperson, they're no different. These are not next to God, just people who make a ton of money too by doing the wrong thing too often. Like, for example, heart surgery. My God, we could spend a whole hour on that. Every single study shows that heart surgery, the angioplasty procedures do not save lives. And almost every single study shows that open heart surgery does not save lives. And that's work that started in the 1970s, right up to today. I can go through you study by study by study. Without exception, you'll find exactly what I said. And they make a lot of money. What do they make?
You'll do that in your heart disease.
I didn't have a heart disease. I've done that in the newsletters too. You can see, or in the book, McDougall's Medicine, A Challenging Second Opinion, or the McDougall Program for a Healthy Heart. So, I don't exaggerate, ladies and gentlemen. I do study things hard and come to conclusions that I've not found people, maybe they do behind my back, but I really haven't found anybody, colleagues, et cetera, that to my face tells me I'm wrong. And if they ever did, I would take them serious and I would go see if I made a mistake. I don't have to teach you some kind of
Well, that's
fantasy.
when you look up all this stuff and you report on it the next week.
Yeah. Maybe ask me a question I don't know the answer to.
Okay.
Okay, well, I know you know the answer to this next one. This is from Video 1000 Nights. If you eat more calories than you burn in starches, will the excess be stored as fat?
No. Well, only with difficulty. It's called de novo lipogenesis. And it's the conversion of sugar, starch, it's sugar, it's glucose, chains of glucose, into fat. It's very expensive to do this. And it costs 30% of the calories that you eat to make that conversion, because you've got to change your ring structure. You've got the carbons, 5, 6 carbons in a ring. You've got to change it to a chain structure, which is a line of carbons. It's costly. It's called de novo lipogenesis. And every single research paper shows that de novo lipogenesis is insignificant in the human being.
But I would say something else, though. The problem is maybe you're eating more starches than you need, but what about if you also ate some fat that day? Then the fat would be stored in the fat cells, and you'd use that and you'd burn off the carbohydrates.
Yeah, that's what happens.
So I mean, is there anyone who only eats carbohydrates?
You and I.
I know, but I mean, a lot of other people.
I don't know, but I do know that they eat calorie bombs, like cake and pies and ice cream.
But even nuts. and
Well,
seeds.
Yeah, nuts and seeds, but they have
Too
mostly
many of
fat.
them.
They're mostly, but let's talk about these calorie
Okay.
bombs for a minute.
Right.
You see, these calorie bombs, the cakes and the pies and the ice creams and so on, they're half sugar and half fat. The sugar raises your insulin levels. Insulin stuffs fat into fat cells. So you have this double whammy working against you. Anyway, even eating pure sugar, it's very difficult to gain weight. But like you said, Mary, eating sugar with fat. And if you eat an excess amount of sugar, the body's going to burn the sugar. It's going to leave the fat in your fat cells.
Yeah, that's what I
you wanted to say.
wanted to say.
All right. Anyway, why do they mix? You like the sugar, you don't like the fat. Why do they mix the two? You know what dietitians say? It's the mouthfeel. Because people don't like fat. You can't get somebody to drink a half a bottle of olive oil or take a couple of teaspoons of lard. Disgusting. So they have to go to something called mouthfeel. That the fat makes it smooth. Did I tell you these people will invent so much stuff?
Okay, thank you. Next question. This is from John. What would one expect to achieve with Kempner's rice diet for a person with both kidneys shut down? Will the kidneys rejuvenate, or do you just have a better time with it?
No, they won't regenerate. Our lost kidneys are lost. If you've lost your kidney function, it won't come back. There's a little improvement. You can see a little improvement because of getting off medications. You get a reduction in BUN and creatinine, which are measurements on how the kidney function is. You get a little improvement when you get off the medication, a little improvement because of some of the physiologic changes, but the actual kidney tissue is gone.
So maybe you wouldn't need to have dialysis as often
Well,
as you if you went on the Kempner diet.
Yeah, that's the next step in this thing. But
But if you don't have kidneys, you have to do something with the
Well,
waste, so you have to be on dialysis.
you have to be on dialysis. You have to be on usually you go on a dialysis machine, but you do. So we'll go into that for a minute.
Okay.
And by the way, this is discussed in McDougall's Medicine and Challenging Second Opinion also, which I wrote many years ago and updated on the website under Hot Topics, kidney disease. But if you have dialysis, you're on dialysis, what you're told is you need to be on a low protein diet. All right. And you're not really told what a low protein diet is. You're just told you need to be on a high protein diet. And then they shovel you off to the dialysis ward and they say, look, this machine will suck off whatever you eat. Just suck it off. You can eat anything you want. We'll suck it off. Well, that ain't true. And if you eat a good diet and you have lost all your kidney function, what you can expect is you'll spend less time in the dialysis lab or the dialysis ward. You'll have less time dialyzing. Why? Because you have less toxic material to get out of the system. They'll put you on a low potassium bath because vegetable diet's higher in potassium. But that's easy to suck the potassium off. You'll have less heart disease. The number one reason that people with kidney failure die is because of heart attacks. Same thing that people without kidney disease die. So you have less heart disease. I've seen some of my kidney patients, they have sores all over their body. They clear up. Just a whole bunch of stuff from the toxins that you eat on the Western diet is eliminated. So the body does much better, but you're not gonna get off the dialysis machine. Hopefully you'll get a kidney transplant. Now let's talk about something just short of being on dialysis. Say you've lost, well, you have to lose 75% of your kidneys before you even notice. So you got 25% left. That's all you need to clear out all the waste in the body. So once you've lost 25% of your kidney or 75% of your kidney function, then your BUN and creatinine start to go up. Okay. Then you have to start being concerned about potassium. When you get to having lost about 90% of your kidney function, then the potassium you eat becomes really important. And you'll learn from my work what you have to do then. But the important thing is even if you've lost some kidney function, that if you go on a good diet, the rate of progression dramatically decreases and you preserve what kidney material is left. No matter what the reason is for you to have lost kidney function, an auto accident, donated it, diabetes, polycystic kidney disease, glomerulonephritis. No, I don't care what it is. If you go on a low protein diet, you'll slow the progression of loss of your kidneys because you decrease the rate of perfusion and the perfusion pressures in the kidney tubules. Now, the average American loses, by the time they're Mary's and my age, in their 70s, you lose 25% of your kidney function if you eat the Western diet. I would expect that our kidney function is much better than that because we've eaten well for the last a long time, 1977. 1977.
Yeah.
I date that. We've eaten pretty good. So I would guess that we haven't lost the 25% of kidney function that a typical American loses. But it doesn't matter because you have to lose 75% of your kidney function to even notice. So you wouldn't know. But anyway, when you get down to having lost half your kidneys, then you need to be on a low protein diet. And by the way, standard recommendations for people who get kidney transplants are for the donor, okay, the person who gives the kidney, and the recipient, the person who gets the kidney, to go on a low protein diet because you've lost half your kidney function by donating a kidney. Anyway, you can do a lot for yourself. Is it easy if you're on dialysis to do what I recommend? No. Have I had people do it? Yes. Have they benefited greatly? Yes. Have they had to fight with their renal doctors and renal dietitians? Yes. Is it worth it? Yes. I would certainly do it if it was my life, whether or not I was healthy, whether I had to stay on a kidney machine or not. And by the way, you're going to be so much better when that kidney comes around, when that donor kidney appears. You're going to be a much better surgical risk. You're going to be much more likely to keep the kidney and not reject it if you eat a healthy diet. Yeah. Next.
Great.
Hey,
Thank
nobody's
you.
asked me a question. I have to look up this weekend.
I know. We've only got a few minutes left. I'll try and see if I can stump you. This one's going to be easy. This next one is from Lucas, and he's wondering how to eat the McDougall diet and not feel fatigued. He's done it in the past and did really well, but just felt tired. So any suggestions?
Yeah. More food.
Become a grazer.
What happens commonly is people eat the same amount of food when they switch to our diet as they ate before. But our food is so calorie dilute. You have to eat a lot more, maybe twice as much food. And people get fatigued when they're calorie deficient. Now, let me give you some examples of people who eat our diet who are not fatigued, like Carl Lewis. You go to our website and listen to a radio interview I did with Carl Lewis, who followed the McDougall diet and set the world record for the 100-meter dash. He did that on the McDougall diet. It's well documented. He'll tell you on the radio show. He set the record for 3 of the best long jumps ever done. He won what do they call it? Relay races. Yeah. set records. He retired at age 35, 36 years old. He wasn't fatigued. But I think it's just a matter of, first, you got to get over the mental problem. You've been taught all this time that eating animal foods make you strong, make you, I don't know, energetic, but it's not true. Real athletes, the runners do this. They carbohydrate load. Think about all the winners of the marathons. I can go back 4 or 5 years. The winners of the marathons in New York, Boston, Chicago, Honolulu, all of these winners came from Ethiopia and Kenya, where 80% of their food is corn.
And they were all really thin.
Really thin and real strong.
Yeah.
And they didn't get tired.
After 26 miles.
Really. So, it's just a lot of nonsense. But the problem might be that you're not eating enough food. And the problem there might be you don't like the food. Well, fix the food so you like it. That's what we worked hard on. Mary and Heather have worked really hard on that. Mary spent 40 years trying to make the food enjoyable for you and put out nearly 4,000 recipes. Just got to find 1 or 2 things you like. And as we suggest, which is different than a lot of people who we think are really good doctors, we recommend that you use a little salt and a little sugar on the surface of the food to make it taste better, so you'll eat it. You like salt and sugar, that's what you really like. The tip of the tongue dictates that.
Okay, thank you. So bringing this back around to our Alzheimer's and aluminum discussion, Cheryl is wondering if she needs to get rid of her antiperspirants right away.
Absolutely. This should be the last time you spray aluminum in your nose.
Or even roll it on, right?
Roll it on, yeah.
It is absorbed through the skin too. But
you can buy deodorants.
Yeah. And these antiperspirants, which are all made of aluminum chloride, you don't stop the sweat unless you have aluminum chloride. Doesn't work. But as Mary said, you can use deodorants. They don't have aluminum chloride, but that's different than stopping the perspiration. They used to be really popular. They were the thing of the day. And then
They're coming back.
Right. But for a while there, they disappeared. And now they're coming back. They think the audience has forgotten the connection between Alzheimer's and aluminum.
Well, they have a new kind of spray now. It's called a powder spray. So it's supposed to be better. I don't know why either. But
you should not do that.
New marketing.
But, the first step you do to taking care of the sweat problem is you make the sweat smell good. If you eat dead animals, you smell like dead animals. If you eat a starch-based diet, you smell like starch-based diet. I'd rather smell like rice than pigs. How about you? Anyway, sweat's natural. It's normal. I don't know. I think the reason they've got such a bad reputation is because sweat carries all the stink.
Now, one last question about aluminum. What about aluminum cans? Do we need to worry about that?
Well, I think so. And I've got to do some research. If I need to ask me a question, I really need to do some more research on it. For a while there, and the research showed, they even went with different brands of soft drinks, the colas versus the orange drinks, et cetera. And they looked at the amount of aluminum in each one of these products. And so, I told people to swear off aluminum cans. And then the rumor is they coat the cans. I mean, you read this, but I've got to research this. That they coat the cans now to keep the beverage away from the aluminum can. But I don't know whether I believe that or not. I got to look into it.
Next week,
I'll talk about that. That's my homework. Thank you. Anyway, in the meantime, I would stay away from the aluminum cans.
Okay, thank you. It's 6 o'clock. We've run out of time.
Can we just take 30 seconds and tell people what we're up to?
Absolutely.
We're doing a series of 10 lectures with a bonus lecture on medical problems. And there's going to be once a week, probably on a Saturday. It's coming up, so just be aware of it. It would be like our series of 4 lectures that we just did on nutrition. We just did a series on protein, fats, carbohydrates, and vitamins and minerals. So that's done. You missed that. These are paid for lectures. There's going to be 10 lectures that are going to talk about One day heart disease, another day cholesterol and high blood pressure, another day breast cancer, another day colon cancer, another day autoimmune diseases, et cetera. Osteoporosis. There'll be just one solid hour, hour and a half dedicated to what I know and believe about these diseases with a whole bunch of scientific background and all the references. And you get the slides. So you can look it up. You can show it to your friends. They're paid for it. They're coming up. And the other thing, we got a 12-day program starting in a few days, don't we?
On Friday,
Friday. What date is that? Just in case I forget.
January 13th.
2023.
That's
I
right.
hope so.
Well, I know, but people are going to be watching this lecture 10 years
Oh,
ago.
okay.
So I want to make sure you know. But anyway, you want to find out more about anything that we're doing, sign up for the newsletter. All kinds of social media that Heather's involved in, and yeah, there are a bunch of other things I wanted to tell you, but that's enough for you.
Until next Sunday. That was great. Thanks, Mom and
5
Dad,
o'clock.
Dr. McDougall and Mary. Next Sunday, 5 p.m. Pacific. We'll see you all there.
All right.
Thanks for being
Thank
with
you,
us.
Heather. Thank you, Heather. It
Thank
was
you.
great to have you lead the discussion.
That was great. See you